Good morning. Sorry for the delay. I am Arthur Gonzalez, the Chairman of the Financial Oversight Management Board for Puerto Rico. I would like to welcome everyone joining us today for the Oversight Board's first public meeting of 2025, which is our 47th public meeting overall, and which is being held at the Puerto Rico Convention Center. Some board members are joining us virtually by Zoom. To begin the meeting, I would like to start with a roll call to formally determine if we have a quorum. Dr. Biggs.
Present.
Cameron McKenzie.
Present.
John Nixon.
Present.
Betty Rosa. I believe Betty is not able to join us as yet. Juan Sabater. Juan as well is not able to join us. Luis Abinos. All right. Our ex officio member, Governor Jennifer Gonzalez, is a bit delayed, so she should be here hopefully shortly and will join us on the dais. For the moment, Francisco Dominique, our Chief of Staff, is here on my left. And welcome.
Thank you.
Before we continue, I'd like to take a moment to, I'll delay what I was going to say and wait for the governor to be here. I'm reading ahead of thinking. All right. As usual, I'd like to ask our General Counsel, Mr. Jaime Ocore, if he would be willing to act as secretary for this meeting. Thank you, Jaime. I would also like to thank everyone watching the live stream of this meeting via the Oversight Board's website, www.oversightboard.pr.gov. The audio of this meeting is available in English, and there is also a simultaneous Spanish translation. Additionally, the meeting is being translated into sign language. If you log into the English language website, the audio will be in English, and if you log into the Spanish website, you will hear the simultaneous translation. As usual, we will be handling questions and comments from our online participants through a form that is available on our website. You can find this form on the live stream page and complete it by putting your name and adding any questions or comments you might have. You can post comments or questions until 15 minutes before the end of the meeting. We will provide answers on our website. We will give an opportunity for any live comments towards the end of the meeting. We have the following agenda items for today. Approval of the minutes of the public meeting and executive sessions of the Oversight Board. Administrative matters, update from the Executive Director, remarks later from Governor Jennifer Gonzalez, presentation on Puerto Rico healthcare workforce study, public commentary, other matters, and adjournment. Begin with the approval of the minutes. The first order of business is to approve the minutes of our last meeting, which was held on December 11, 2024. The minutes are attached to the meeting materials as Appendix A. We will also need to approve the minutes from a series of executive sessions held since that public meeting. Those executive sessions were held on December 20th, 2024, January 3rd, January 10th, January 24th, January 31st, February 6th, February 14th, and February 21st, 2025. The minutes of the executive sessions are attached to the meeting materials as Exhibit B. Are there any questions about the minutes? There being no questions, do I have a motion to approve the minutes?
Mr. Chair, I'd like to move to approve the minutes of the last public board meeting held on December 11, 2024, which are attached to the meeting materials as Appendix A, and the minutes of the executive sessions held on December 20th, 2024, January 3rd, January 10th, January 24th, January 31st, February 6th, February 14th, and February 21st, 2025, which are attached to the meeting materials as Appendix B in the form presented to the meeting.
Thank you, John. Do we have a second?
I second the motion.
Thank you. I would like to ask for a voice vote. First, all in favor, please say yes.
Yes.
Those opposed, please say no. If you are abstaining, please say abstain. All in favor?
Yes.
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 Any opposed? Any abstentions? All of the board having voted in favor, the motion passes and the minutes are approved. Administrative matters. Next, we have a couple of routine administrative matters. Would someone make the first motion?
Mr. Chair, I'd like to make the following motion. Between the adjournment of this meeting and the opening of the Oversight Board's next public meeting, the Oversight Board may consider an executive session any and all matters that it is authorized to consider under PROMESA, including first, any certification determinations authorized by PROMESA, including certification determinations under Section 206 of PROMESA. Second, any submissions or authorizations authorized by PROMESA. And third, any filings authorized under Title III of PROMESA, in each case that are set forth as part of the vote to convene such executive session. The Oversight Board may also act by unanimous written consent between meetings in accordance with this bylaws, which such consent to include consent by electronic transmission.
Thank you, Andrew. Do we have a second?
I'll second.
Thank you, John. Would all in favor say yes?
Yes.
Yes.
Any opposed?
Yes.
Any abstentions? All of the members present having voted in favor, the motion passes. We have one more motion which relates to unanimous written consents. Would someone make that motion?
Mr. Chair, I move to confirm and approve any unanimous written consents adopted by the Oversight Board since the adjournment of our last public meeting.
Thank you, John. Do we have a second?
I'll second.
Thank you, Andrew. Will all in favor say yes?
Yes.
Yes.
Any opposed? Any abstentions? All of the members present having voted in favor, the motion passes as well. Next, we will move to the substance of today's public meeting. I will open the floor to our Executive Director, Robert Mojica, for an overview of the Oversight's work since our last public meeting held in December. Robert, the floor is yours.
Thank you, Chair Gonzalez. The Oversight Board was able to achieve significant progress in the first 2 months of 2025. We engaged with the new administration of Governor Jennifer Gonzalez Colon to begin what I hope will be a productive cooperation on several key priorities to move Puerto Rico and its economy forward. My own conversations with the governor and her team gives me confidence that our goals are aligned. Those goals are to establish permanent and robust financial management practices so that the Oversight Board can restore fiscal responsibility and terminate as foreseen under PROMESA. Together, we should reform Puerto Rico's financial management practices and systems. These reformed practices will improve the education system by improving transparency around the allocation of funding and better align Puerto Rico's limited resources to improve Puerto Rico's healthcare system. We are adopting a systematic approach to assess initiatives to improve the healthcare delivery system here in Puerto Rico. The information that you'll hear today will inform how budgeted resources are allocated using data and facts. Education and healthcare affect every family in Puerto Rico every day and impact migration and economic growth. In the area of education, as we are developing the budget for next year, we need to ensure that funding gets to the classroom and plans are implemented now to reflect the end of non-recurring federal funding. Multi-year budget planning is critical to ensure that we are prepared to meet the needs of Puerto Rico, not just this year, but in the coming years as well. We need to make sure we find the right solution with the right balance and find them soon to improve the quality of life in Puerto Rico and also to improve Puerto Rico's economic future. We will work together to continue the successful reform and improve the delivery of public services in Puerto Rico by building a more efficient civil service. We made significant progress last year in implementing civil service reform, particularly in the Department of Education. This reform is focused on improving the government's ability to retain professionals who can deliver services by improving the skills, the career opportunities, and the motivation of our civil service. We will improve government and the services our civil servants deliver to the people of Puerto Rico. Last week, we held a webinar with government officials and industry experts to discuss the ongoing progress with the civil service reform. The webinar focused on the results of the talent acquisition pilot that began last year, which involved 9 government agencies. The pilot is intended to assess new recruitment policies and the use of artificial intelligence for candidate screening and evaluation. The pilot had great results. It showed significant improvement on existing recruitment outcomes. Time to hire went from months to weeks, and hiring managers indicated that they were able to find and hire better talent at their agencies. The collaborative work between the Oversight Board and the government of Puerto Rico was showing results and was recently featured in a report from the National Governors Association, which identified Puerto Rico as a national leader in civil service practices. This is just one example of what we can achieve when we are working together. We also look forward to working with Governor González Colón and her administration on economic growth initiatives to address Puerto Rico's most critical challenges through a coordinated integration of economic development efforts supported by the Oversight Board and our Economic Growth and Revitalization Coordinator, Jose Perez Riera, and the Secretary of the Department of Economic Development and Commerce and business and community stakeholders. The Oversight Board's team and I met earlier this month with a group of key members of the governor's administration to kickstart these efforts, and I am certain that we can accomplish a lot together. Permitting and tax reforms are priorities that the Oversight Board shares with the government, and particularly on permit reform, we are already moving forward in this collaboration. Our goal is to work with the government to provide knowledge and resources to execute on all of these initiatives. On health, you will hear today about a workforce assessment that the Oversight Board, together with the Puerto Rico Department of Health and the FOF, asked the healthcare team of FTI Consulting to provide. FTI's report will help us understand the current state of Puerto Rico's healthcare workforce, and through analysis and facts and data, compile recommendations about how to move forward. As part of the study, more than 700 healthcare professionals, including doctors, nurses, technicians, and others were contacted. We analyzed enrollment records, claim statistics, physician and emergency room visits, and other healthcare data. And we have asked the FTI team here today to present the study and the recommendations. We will then get together with the healthcare stakeholders and the government to decide what solutions we should pursue and implement together. The Oversight Board also worked with the government to allocate $89 million in additional funding for municipal governments in this year's budget. In this case, we worked together with the Office of Management and Budget, the Federation of Mayors, the Association of Mayors, and just to be clear, the Puerto Rico government supports the municipalities with almost $350 million this year. Of that $350 million, $89 million was added specifically to support targeted programs and municipalities most in need of additional funding. The social well-being program, Ama de Llaves, received $15 million of additional funding. The medical emergency services response program received $9 million, and $30 million was allocated to municipalities with the most need to support essential services. The Ama de Llaves program provides services by municipalities, such as essential help with hygiene, home management, the administration of medications for older and disabled persons. The Medical Emergency Services Program helps municipalities that participate in 911 emergency response services. And based on the applicable criteria and requirements, 38 municipalities qualified for additional medical emergency response program funding, and 51 municipalities met the requirements for additional Ama de Llaves program funding. We anticipate allocating the remaining $35 million to municipalities as part of the central government's efforts to improve collaboration on joint initiatives that impact the economy of Puerto Rico. The Oversight Board fully understands the challenges that the municipalities face in providing social well-being services for its residents and continues to support Puerto Rico's mayors and their staff to ensure that they can serve their residents well. This month, you, the Oversight Board members, also certified a new fiscal plan for PREPA. The new fiscal plan is an X-ray of a system that has been failing Puerto Rico's families and businesses for too long. Considering recent power outages, the Oversight Board and the Puerto Rico Energy Bureau and the government must be able to fully understand what is required to meet the needs of the system to deliver reliable power. That is why we ask the system operators, including PREPA, to help us see and analyze. PREPA operates an outdated system that's vulnerable to shock and unable to provide reliable electricity. This is the consequence of decades of neglect, deferred maintenance, missed system upgrades, lack of long-term planning, and interference by previous governments before PROMESA was enacted, and the Oversight Board, together with the administration of Governor Rosselló Nevares, introduced a more rational operating structure under the oversight of an Energy Bureau as a truly independent regulator. But these critical improvements in operating structure, increased efforts to upkeep and improve the system, and the addition of new resources of generation proved to be insufficient to even fully restore the system, much less provide sustained reliability. Recent reliability shows that the system is still underperforming when you compare it to other U.S. utilities. PREPA has not performed an evaluation of the long-term system needs in over 30 years. It has been operating under a structural financial deficit since 2004. And in its 2017 rate order, the predecessor to the Puerto Rico Energy Bureau, back in 2017, stated that PREPA's long-term planning was, in the past, distorted by political considerations, resulting in, I quote, operational instability, expensive changes in direction, and delays and stoppages of necessary infrastructure projects, end quote. The regulator stated back then that PREPA based its budget on a compromise, driven, and I quote again, not by system needs alone, end quote. The Oversight Board is determined to prevent the same mistake from happening again. The new fiscal plan is based on operators' expense projections to reflect the true needs of the energy system for adequate operation, maintenance, repair, and transformation of Puerto Rico's energy system. A coordinated, holistic financial plan is essential to prioritize and sequence investments for impactful transformation. We know that the governor is working tirelessly to find solutions to the energy crisis, and board staff has participated in the governor's Energy Transformation Task Force, and we look forward to continuing these efforts. The Oversight Board's goal is to successfully transform the energy system in Puerto Rico, ensuring reliable, affordable service for Puerto Rico while exiting the bankruptcy process under Title III of PROMESA and providing for the restoration of access to the capital markets. And I am convinced that the government shares this goal. Together, the government and the Oversight Board also began the process to develop the budget for next fiscal year 2026, which will begin on July 1, 2025. As we enter what we consider the final phases of PROMESA, the most critical work will be to improve the budget process and provide transparent financial plans, not just for the upcoming fiscal year, but at a minimum for the next 5 years. We will work with the government to achieve these goals. There are significant structural budget gaps in the years ahead that must be acknowledged and also planned for. The economy has slowed, as has the growth of the government's revenue from taxes. In addition, non-recurring federal funds will be exhausted. Long-term budget planning is critical to identify our out-year spending needs, and the government must adopt realistic revenue forecasts to prevent returning to the pre-Promesa deficits. Prior to Promesa, spending was higher than revenue for 16 consecutive years, according to the government's own audited financial statements. Puerto Rico has many spending needs, and we will work with Governor Gonzalez Colon and her administration to establish the priorities while maintaining a fiscally responsible budget. Money from the federal government provides currently nearly half of the Commonwealth's overall budget. This includes the current Medicaid formula, which expires in 2 years. And as we move forward with this budget, we must balance the needs and the risks and solve for an out-year structural gaps. Having a budget management system that actually works, a budget management system that the government, the people, and the financial markets have confidence in, that is transparent and open, is critical for achieving fiscal responsibility. This is not to check a box on the path to fulfill the mandate of Promesa, but is critically important for Puerto Rico's future, its stability, and economic growth and quality of life. And then when we get to 4 years of balanced budgets, we can say what happened in 2016 will not happen again. The initial Commonwealth budget targets for the upcoming fiscal year did not envision any spending cuts. We established a budget target of $13.3 billion for the general fund and $5.1 billion for the special revenue fund that will support key government priorities and financial and fiscal plan initiatives. The general fund and the special revenue fund targets combined would increase spending by just under 3% in the next fiscal year from the current fiscal year certified budget. The government has provided further information to move the Commonwealth process forward, and the Oversight Board is in the process of reviewing this information. We hope we can meet as early as this week to continue our cooperation. As every year, you, the board members, will certify a budget that complies with the fiscal plan on or before June 30th. Our goal is for Puerto Rico to have a budget that is balanced, responsible, and meets the needs of the people of Puerto Rico. I am sure here again we are aligned with the government in our goals. Thank you, Mr. Chair.
Thank you, Robert. Any board members seek to question or comment on a presentation from our executive director? No response being heard. Let me turn to Judge, I'm thinking of myself, Governor Gonzalez Colon, and welcome her today to be here. We know your schedule is extremely busy and very important, and greatly appreciate you taking the time to be with us today. Further, I'd like to take a moment to welcome, as I did the Governor, to our first public meeting as ex officio member of the Oversight Board. Some of the members of the board, including myself and our executive director, have met Governor Gonzalez several times since she took office last month, and our executive director met with her many times in Washington in her prior role as resident commissioner. We feel confident that we are aligned and in our priorities for Puerto Rico, and look forward to working with her administration, as well with the new legislative leadership to advance our mandate. Governor Gonzalez.
Thank you, Chairman, and thank you. Good morning to everybody, members of the board, staff members of the board, officials to the government of Puerto Rico, and of course the public that are here or even looking at the streaming this first meeting. I'm happy to be here for your first meeting during my first term as the governor of Puerto Rico. I remember being here several years ago as a member of Congress asking permit to express myself during my first time in that office. And as I announced back in December, it is my intention as governor to directly participate in my position as an ex officio member of this board, as opposed to delegating it to a representative. Nonetheless, my chief of staff and executive director of FOMB is going to be here as well, and I know he's going to be assisting me in this endeavor. This process is such a scale and scope, and it's so vital for the future progress of Puerto Rico that the person who was directly elected by the people of the island to implement and enact the public policy of its government. It is directly involved in the discussions and decision-making process of this board. That participation, in turn, requires straightforward, open, and timely communication, and I believe that's the best way to solve many things and problems. I strongly believe in good bilateral communication, and I believe it is paramount that the governor of Puerto Rico learns of important developments and decisions in a timely manner, and is a party of any discussion that impacts the life of the residents of the island before matters are released to the public. Any announcement must be given to the officials that the people of Puerto Rico entrusted to represent them, and the chance to formulate a well-considered response that are formulated, I hope, will be considered by this board as well. I have always believed that honest, transparent, bilateral communication is key in any strong partnership, and it's necessary to have any successful negotiation outcome. To that end, I really believe that this board got many things on the table, and as part of Puerto Rico's colonial situation, Congress created PROMESA and this board within their plenary powers over the territories. And that is a reality we must deal with, and we must work to have this structure fulfill its goal. To that end, so that democratically elected government officials can work on the policies the people voted for without having its hands tied. My administration is bringing a new pragmatic vision to the way the government operates, and I'm talking about the local government, which is solely focused on results. It is based on making processes flow efficiently, using the allocated federal and state resources effectively, and getting things done. To that end, I have issued executive orders seeking the streamline of permitting, fast-tracking the rebuilding of our energy grid, making the government more efficient, and cutting bureaucracy and red tape. In this process, it is vital for the different agencies, entities, and organizations at the federal and state levels to facilitate all processes and not allow themselves to have their hands tied with small minutiae details in the government regulations. To that end, I got the opportunity to face that we have already started seeing low sheds in this year. For my administration, one of the priorities are to achieve generation system stability. And I believe that's one of the common issues that people of the island want to have resolved. And for that, adjust our energy portfolio to reflect a reality and intensity of oversight of the private operation and management of contractors. And recently, in meetings in Washington last week, officials at the Department of Energy, Interior, FEMA, EPA, and the White House all expressed their support for quick and decisive action. And I thank them for that. We're going to be using all executive orders the President just submitted recently in January to expedite a lot of the processes the island is being involved. At the same time, we need to minimize the economic impact upon the individual consumers, small and medium-sized businesses, the manufacturing sector, and communities to make this an energy grid that is reliable and economical. There are tools under PROMESA Title V to move strategic projects that have been not used so far, and we need to take advantage of them. And the debt restructuring must lead to a path to be able to make capital investment on the energy infrastructure. I know we can work together if the aim of bringing back Puerto Rico's economic growth is placed front and center. And I am all in to fulfill this goal. I hope we can all agree to be all in and let us make a new start toward this goal. Thank you, Mr. Chairman and members of the board.
Thank you, Governor. As I mentioned, we look forward to working with you and are aligned in all most important tasks that need to be accomplished. Any board member or Robert wish to comment on the governor's statement?
I'd like to just, first of all, publicly express congratulations, Governor. She and I had the opportunity to chat for a few minutes this past week in Washington, D.C., and I look forward as a board member to working with you and getting to know your administration. We obviously, the success of your administration is paramount to the future of Puerto Rico, and as a board, we might not and most likely won't agree on everything, but clearly it's important that we talk through our differences and that we support each other with a common goal to making Puerto Rico a better place, that where all Puerto Ricans can grow and flourish. And to me personally, and as I know my fellow colleagues on the board are very committed to making that happen. So we look forward to working with you and Francisco and your team to that end.
Chairman, if you allow me.
Certainly.
I want to say thank you to members of the board that we've been having meetings along all these years discussing many different issues regarding Puerto Rico, from energy, permitting, healthcare, oversight, and many other areas. And I know there are going to be some areas that we may disagree, and we should at least agree to disagree on many of them. But having an open line of communication and knowing what's ahead for the people of the island. And I really believe, I was against the board. I was against Promesa. That's on the record. But we must deal with it and finish what is started. I believe the restructuring of many of the deals are being done. We're just facing the PREPA situation and many others that should be addressed. And I know we can work that in with an open line of communication. I really believe that's the only way to get this done. So thank you.
Thank you, Governor. Anyone else wish to be heard? No further comment being heard. We'll turn the floor over to Armando Cruz. Armando Cruz, our Deputy Executive Director, who will introduce our next order of business, which will be a presentation on the findings of a Puerto Rico healthcare workforce study conducted by FTI Consulting, Inc. Armando, the floor is yours.
No.
Sí. Thank you, Mr. Chairman, Executive Director, board members. Saludo, Gobernadora Francisco. Welcome to the board meeting today. So just wanted to provide some context on the presentation you're going to hear today. Healthcare is instrumental to our island, and a critical component of healthcare is its workforce. For years, we have heard that there's a need for more doctors on the island, that we have huge gaps in particular providers, but data has been a challenge. Getting the right data to not just understand the gaps, but understand where the gaps are on the island and why do we have those gaps. So given the importance of having data to make decisions, not just in the public sphere, but also information that private stakeholders can make, last year we decided to do a study so we can better understand these gaps on the island. We did an RFP, and several firms submitted proposals, and we ended up selecting FTI Consulting to do the study. FTI has been working on the study for the last 6 months, and we finally have the final report that you'll see today. And in an effort to really understand where are the gaps and how big the gaps are, so we can make informed decisions about how to close them in the future. So you'll see representatives from FTI go through the report, the methodology, the findings, and some general recommendations that we're hoping we can start working with the government and the private stakeholders around how do we go about solving these gaps. So, Mr. Chairman, without further ado, the FTI consulting team.
All right. Good morning, everybody. Thank you for the opportunity to present this very comprehensive study. Thank you to the members of the board, the governor, chief of staff. I'm Juan Montañez. I'm with FTI Consulting. With me are, to my left, Dr. Susan Manning from FTI Center for Healthcare Economics and Policy, Maria Levis, the CEO of Impactivo, our essential partner on this project, which it required significant stakeholder engagement, which she led. And then to my right is Annie Mayol, also from FTI Consulting, who day-to-day led the team that worked for more than 6 months on this very extensive project. Briefly, to share a little bit about the study itself and the scope of it, it is impossible really to ascertain the challenges that we're having with Puerto Rico's healthcare workforce supply if we don't understand the demand for those services that the workforce is required for. So we started the project by modeling the demand for different healthcare workforce categories based on the needs of the population and the services that they were expected to require, not just now, but into the future, because we want to make sure that any recommendations were focused on the future needs of the population, not current needs, so that we try to stay ahead, not chase demand, but get in front of future demand. Then we looked at the workforce supply, and we took in data from more than 20 different organizations, almost 400,000 records from the licensing board, from insurance companies, from the government agencies that actually run healthcare programs, and assembled all that information to create as comprehensive and as credible a picture of the workforce supply as we could. Then we married those two data sources to ascertain the imbalance between supply and demand and focused on those categories of the workforce, whether it's physician specialist or other categories that might not be immediately apparent where we do have shortages, that might actually be as critical or more so than with some of the physicians, to be able to understand what those imbalances are, and then through a very extensive qualitative process, stakeholder engagement interviews, a survey, to try to understand what drives that imbalance. Why do we not have more workforce? And what are the underlying causes? And then based on that, we formulated recommendations. A couple of key points that I want to make. When we talk about supply, it's very important to recognize that supply is not purely a function of the number of physicians or the number of physical therapists or the number of lab technicians. You got to look at their availability, how available they are in terms of hours of operations, their capacity to provide services. Are they, for example, so burdened by administrative work that they don't have as much time as might be apparent for them to provide services or manage services? And then their accessibility. If they're located in the part of the island that makes it very difficult for the typical Puerto Rican to get to them, that becomes a challenge too. So you can not just rely on the hard numbers of how many of something we have. We got to look at all these other factors. And then there are a couple of critical assets that we turn over to the Oversight Board with the goal that this becomes, and I know it's a bit of a cliche, a living assessment, a living study, because this is going to be very dynamic. The workforce changes, the needs of the population might change. We created a workforce profile and a model that we'll describe in more detail throughout this presentation that hopefully can be used for continuing analysis. A very critical component of this project was the engagement that we did with the community as a whole. We talked to hospitals, we talked to insurance companies, we talked to associations that represent different critical constituencies within the healthcare system, and Maria can give you a bit more detail on that whole process.
Of course. In order to ground the study in Puerto Rico's reality, we made sure that we carried out extensive interviews with key stakeholders across all the groups that Juan just mentioned. This included over 70 key stakeholders and 22 organizations that participated not just to inform the questions that we were going to ask in the survey, but to also help us understand what drives the access issue, what complexities there are, and what viable solutions exist. Unanimously, the voices all mentioned that the situation is dire. And what you guys will see in the report does present a grim picture. I will add, we are at a tipping point. This situation impacts us all. So what we also saw was irrefutable commitment from all stakeholders to move beyond their interests in order to achieve solutions. We were even able to identify some solutions that could be put in place within a year.
Thank you. So let's talk about the findings. And yes, some of these findings might be a bit difficult in terms of painting a picture that might be a bit too negative, but we are an independent organization when it comes to this project. We do not represent any of the stakeholders in the healthcare system. We have quite a bit of knowledge of the healthcare system in Puerto Rico, which we put to use on the project, but we were charged with presenting as real a picture as possible, not just of the challenges, but also identify potential ways to correct these problems. And it'll be multiple solutions that will have to be implemented in a very coordinated way to get us out of this predicament, but we can't get out of it. But we got to understand what the situation is. So with that, we're going to go over the key findings of the study, beginning with Dr. Manning.
Thank you. I will say from an economics perspective that the inability of a jurisdiction to not have sufficient workforce in order to meet the healthcare needs of its population not only adversely affects the health of its residents, but also the jurisdiction's productivity and ability to track economic development. Our approach was very principled. We did not simply do what you would call sort of a trend of what the workforce looks like today and what it would look like tomorrow. We, in fact, did a sort of grounds-up approach, looking at the population characteristics, including the age characteristics and the declining population in Puerto Rico. We also looked at demand characteristics. We looked at the health status of individuals within the Puerto Rico economy. We looked at their social vulnerability, and we also looked particularly at the disease prevalence. And it was the disease prevalence and chronic conditions within the economy that really drove our analyses. In Puerto Rico has very high incidence of high blood pressure, diabetes, asthma, heart conditions and heart attacks, and chronic kidney diseases. And this really impacts the type of physicians that you need on the island and need to recruit in order to resolve this issue. If you look at the chart here, we did an analysis where we projected what the shortage was today by 21 categories of healthcare professionals, and what the gap would be in 2035 and in 2050. The current status of the physicians is that they work longer than you would expect, and certainly longer than what physicians necessarily work in the United States. So the first model that we did looked at basically the current work practices of physicians. And one example is for orthopedics. We currently have in Puerto Rico a severe shortage of orthopedic providers. These are people, of course, that handle bone conditions and et cetera. We need twice as many orthopedic providers than we currently have. That is somewhat mitigated by 2035 because of the decline in the population, but the gap does not go away. Another example would be endocrinologists. Endocrinologists treat chronic kidney disease, which is a very prevalent disease within the Puerto Rico population. Here, we have a gap that is 140% fewer physicians, endocrinologists, than the island needs in order to care for that chronic disease population. And this increases significantly by 2035 if nothing is done. We also looked at the model where we took the position that physicians retire by the age of 65 or become significantly less productive in the number of patients that they see. If you do this, the healthcare shortage gets particularly severe. So normal health practices tells you that the Puerto Rican economy, its workforce gap is severe. I will say that the gap, we believe, is probably underestimated by our projections because of accessibility and because of workforce practices. We think that we are being very conservative in these estimates, and this, as I said, that is probably more severe. With respect to nurses, I will say you are producing sufficient number of nurses, but nurses are almost 100%, once they graduated, leaving the island, or many nurses that stay here have decided to remove themselves from the workforce, either due to wages or work-life balance. We also did our analysis by geography. And this is quite important because the gap is not consistent across the island. In the metro area, for example, with gastroenterologists who handle the digestive system, the metro area, for example, right now has enough specialists in that area to take care of the population, but the northern part of the island and the western part of the island are seeing very severe shortage of physicians in that practice area. Endocrinologists is very similar. In fact, it's even more severe as we look at people who are able to care for chronic kidney disease. If we go to the next slide, we look at the time spent in outpatient settings versus in-hospital settings. And we find the workforce practices on the island are such that our physician workforce actually spends more time in outpatient settings than they do in hospital settings. It's about 90% or so in the outpatient setting versus in the United States where it's about 80%. This actually exacerbates the shortage of workforces and the burnout of the workforce that are actually providing inpatient care within hospitals.
So as Susan mentioned, the problem of access is compounded by a lack not just of physicians, but of nurses and other allied health professionals. As she was mentioning, we have enough trained and licensed nurses, but these nurses are not necessarily available to work in settings like hospitals because of the night shifts and other working conditions, which are much more stressful than what they would see in another type of job. This quote by a physician illustrates extremely well what the problem is and why it's compounded. In short, if we do not have enough nurses, if we do not have enough equipment, if we do not have enough allied health professionals, physicians cannot perform the procedures they need to perform at hospitals. That leads to further access issues, and it also leads to severe losses both for hospitals and for the physicians themselves, compounding the problem.
I'll take on this one. And again, we're not trying to paint a picture that's so grim that people just want to, leave the building and jump out of the building. But we got to paint the picture the way it is. There are deficiencies also in workforce sectors that are not usually seen as being core to the healthcare system. They are, I guess you could say, supportive of the healthcare system. We're talking about security personnel. We're talking about environmental services. You need staff in the hospitals that can clean beds so they can be actually used. Transportation, access to transportation, not just for the patients, but in some cases for the employees themselves, and then child and elder care. Through the interview process, we heard repeatedly that a lot of staff, whether in physician offices or hospitals, sometimes have to deal with the challenge of child care, or they have an elderly family member that they need to take care of too. And the tendency is that in a family that has an employee that works in healthcare, that employee is the one that actually takes care of the elderly, frail family member. So it compounds the problem in terms of the availability of that personnel to manage or deliver healthcare services. And as Maria noted, and perhaps not surprisingly, in hospitals, in very stressful settings, and in late shifts, this becomes a more exacerbated problem. We even heard stories about staff that work at a particular hospital that I won't name that have to park about 30 minutes away from the hospital itself, and then have to wait for a bus in the middle of the night to actually get between the parking location and the hospital. These are challenges that these same individuals, if they were to relocate to the United States, they probably wouldn't have, not to mention the fact that they'd be paid more. So these are issues that might not be specific to the healthcare workforce and them being there to work, but they impact their ability to work, so we got to consider them as well.
One of the things that we looked at was the administrative burden over the physicians and each one of the providers. So when you look at the time, we did the survey to the provider and we asked them how much time they spend doing service directly to patients versus administrative. One of the things that we found was that there's a lot, even though they have the same federal requirements as the United States, even though they have a lot of processes, in Puerto Rico they're faced with two important challenges that increase the percentage of administrative burden over a physician. One is the bureaucratic, the licensing issues that they have with regards to managing their credentialing, their licensing process, and some of those burdens that are more acute here in the island. But then also the technology access, so how much facility and infrastructure they have in their office, and what staff do they have available that can manage the administrative staff versus the physician. We heard stories of surgeons that would have to do a lot of the actual paperwork before the surgery or after the surgery, which is usually provided with a more middle, lower level support system that currently does not exist in Puerto Rico, including nurse practitioners, physician assistants. So that model that has increased and has evolved in the United States we're still behind there. So you'll see here some of the percentages of the time spent by physician administrative tasks, the licensing cycle, 3 months, and how much that is a challenge, and then the credentialing over time, which also creates an additional burden.
One of the critical factors impacting the access problem is the lack of care management and inefficiencies in care. What I mean by this is because we have fewer resources, those resources are taking care of our sickest patients. Puerto Rico has one of the highest emergency room utilization rates in the nation. What that means is that people are getting their chronic diseases addressed in emergency rooms. And emergency rooms were not designed to address those needs. What happens when a patient goes to address a chronic disease in an emergency room? They will come back because the disease was not addressed. And that is something that can actually be improved significantly in a short period of time. As Susan mentioned, some of the highest needs are for those chronic conditions. We need more nephrologists, more endocrinologists, because our population is sicker. And as the quotes here show, everyone within the system is seeing sicker patients. The patients showing up at the emergency room are sicker. The patients showing up in the hospitals are sicker. So we need to be able to reverse that trend. This is one of the areas that I mentioned has significant potential to have a quick, and when I say quick, it could be something within a year, where we can start seeing increased access. And that can be done by developing programs that actually reduce progression of disease. We've seen these programs in Puerto Rico. One example is Hospital General de Castañer. They received funding from the Health Resources and Services Administration to develop a pilot project which uses telehealth in the mountains in the area of Castañer to actually address the needs of patients by sending community health workers out to their homes. The result, we are seeing these patients improve in their diabetes and hypertension metrics, and the overall cost for these very sick patients is a 72% cost reduction. So opportunities exist. Another one of the areas that was mentioned is the opportunity to do something called specialty consults. Specialty consults is when we reimburse specialists to consult to primary care providers, which are available to better manage chronic diseases. As Susan mentions, 80% of spending in healthcare is around chronic diseases. So this is a big area of opportunity, and investment in innovation is critical.
Now, to make all this happen, to be able to get to a place where we are coordinating care more effectively and actually treating the underlying causes of disease, you got to have information. Providers have to have better access to information. They have to have complete information about their patients, their entire history, if at all possible, so they can make informed decisions. Let's face it, in Puerto Rico, that does not happen. We do not have in Puerto Rico, after tens of millions of dollars invested in technology to provide interconnectivity amongst providers through electronic health records, that does not happen today. So individuals have to literally carry their records from provider to provider to provider, and some providers don't have access to information, which can lead to medical errors. It can lead to excessive orders of tests and procedures, and all this drives cost, not to mention the impact that it has on outcomes. This is also the jurisdiction in the U.S. that has the lowest adoption of electronic health records in the United States. There's still a lot of providers billing on paper. There's still a lot of providers charting on paper, and what that does is it adds to the administrative burden of the provider, which means they have less time available to actually work with patients. So improving the underlying technology infrastructure that these healthcare workforce operates in is going to be critical to enable the coordinated care that Maria described and ultimately bend that cost curve and bring costs down, particularly for those sickest patients that have to be seen and require collaboration across multiple providers for them to receive effective care.
One of the things that I would highlight, and I know that the current administration has spoken about this, not just last year, but currently in the last couple of months, is how do we work with laws and regulation that adversely impact healthcare workforce supply? For example, how do we expand the limits that we currently have with access to telehealth so that we have telehealth providers that can give telehealth services to patients in Puerto Rico? How do we reduce the limits of use and scope of practice for physician extenders, nurse practitioners, physician assistants? How do we find a way to innovate our regulations that right now create burdens, protectionists, and limits the ability to access or to support the current providers that we currently have in the island that are doing everything they can to provide services. And I know this is something that we've heard, the incoming government talk about that, as well as the incoming Secretary of Health. And I think this is an area that we can look at. We met and we looked at all of the laws and regulations. And then here, quickly, just highlighting the fact that we have, sometimes there's unintended consequences to certain policy initiatives, and we'll briefly talk about two. For example, we know that the payment model is not adequate to support our, provider healthcare network. However, by increasing the reimbursement rates for one line of business, Medicaid, by increasing the Medicaid rate increases, it created an adverse effect into the commercial side of the business. So physicians have right now there's limited access to physicians for individuals and commercials that are outside of the Medicaid, Medicare Advantage plan that are in the commercial, which is our working class, our small business owners and then that increases an increase in obviously premiums over commercial side. And here you see also the fact that the tax incentives that were implemented did retain the providers in the island. We looked at the data and we also, of the licensing for the past 10 years, but we also did a survey and more than 92% of the physicians that took the incentive law were already in Puerto Rico. So obviously it supported their practice, but it didn't have the effect of necessarily of the bringing new physicians into the island. So we talk about some of the recommendations of how we create incentives that focus more on making sure that we support those new doctors that are coming in, either recently graduates that are coming in the first couple of years.
With respect to training, we do have to commend academia for its efforts to produce high-quality residencies. This is actively happening, and we are seeing expansion. However, we need to look at the problem from a broader perspective. On the one hand, our highly trained physicians and nurses who obtain on-the-job and robust training are being actively recruited by other states where they have better benefits, better pay, and what they do very well is make sure the licensing and the credentialing is available the day the graduate is done with their education. That is what we are competing against. And as Annie mentioned, and our graph shows, our folks are waiting 3 months without any revenue. after they graduate because they can't get the credentialing and the licensing. So that is a big issue with respect to retention. At the same time, there are other programs that do not have residencies. Some of these are for general physicians, some of these are for nurses. And what we are hearing from hospitals and primary care providers is that once these providers are recruited, they take a lot of training, which increases the costs of practice.
So we say funding for last because it tends to be the most controversial subject. And it is clear, and it is beyond well documented, that Puerto Rico does not have the same level of funding for healthcare services than the typical state has. And we don't want to get into that here. But I would echo what Executive Director Mojica said earlier about in an environment where you have constrained funds, you have to make difficult decisions about how you allocate the funds and how you justify the use of those funds and how you coordinate initiatives to take maximum advantage of those funds. We have some recommendations coming up related to that. But it is without a doubt that the funding challenge creates some of the unintended consequences that Annie described before. Providers obviously are going to look to maximize their revenue to stay in business. And they might gravitate towards the program or the payer that actually pays them the most, which can create then imbalance in terms of access to services. So we recognize that funding is a challenge. And we should, of course, continue to lobby for additional funds. An argument that I've made in conversations with my colleagues here is, and hopefully this is something that a congressperson will understand, if somebody lives in Puerto Rico and decides to move to the U.S., the Medicaid program that actually takes on that individual will have to spend 3 times more on that individual than what they spend in Puerto Rico. So it would behoove, one would think, Congress to allocate more funding for Medicaid in Puerto Rico to prevent that from happening. That is the kind of argument that we should be making to Congress, but at the same time, we have to make the most of available funds to better make the case for additional funding. So funding is complicated, we know that, but we should first focus on how we can make the most of existing funding so that we can more easily make the case for additional funding. And that leads us to recommendations. And this might be a little hard to read, but we bucketed recommendations into these 8 categories. And we should start by saying that while we know we presented a picture that's less than positive, it is not an impossibility to address these challenges. We believe that we need to, though, focus on 2 types of initiatives. We have to address the demand side of the equation, while we also address the supply side of the equation. The recommendations that will be focused on demand should be focused using the old Pareto rule of early interventions on impactable health issues and smarter use of healthcare resources so that we're targeting that 10% of the population that consumes 80% of the healthcare resources. And as it happens, as both Dr. Manning and Maria noted, those conditions, for the most part, are impactable. You can prevent chronic kidney disease. You can address or prevent diabetes. You can hopefully address asthma and other respiratory conditions before they become severe, and then you got to be stuck with a can of oxygen. These are controllable, impactable conditions that through better coordinated care, where you bring primary care physicians, specialty physicians, insurance companies, and hospitals together, you can drive down the cost of care, as Maria noted. So all of these recommendations that we're talking about that relate to demand are focused on addressing those impactable health conditions and making smarter use of available resources to improve coordination. On the supply side, we got to look at all the factors that drive supply. We got to look at the quantity, and we got to raise the quantity of particular providers. We got to address availability, make sure that they are open for more hours. We got to address capacity so that when they're available, they can actually see more patients and not be submitting bills or documenting or spending time on administrative stuff that they shouldn't be spending it on. And we got to make the provider more accessible to the patient through telehealth, through opening more locations in the parts of the island that are more underserved and encouraging that so that they're not all pulled in San Juan and Bayamón. And we have to ensure that these supply initiatives are looking at what the demand is going to be 10 years from now. We cannot chase current demand. We got to look at what demand will be in the future because a lot of these programs take time to be implemented. So with that, we came up with these 8 categories of recommendations around more targeted condition, financial, and tax incentives, around increasing supply through the liberalization of laws and regulations that Annie alluded to, make it easier for providers to offer telehealth services, for example, establish greater coordination of workforce development programs, because again, the funds are limited, so we got to make the most of those. Re-engineering administrative process so that a provider doesn't have to wait 6 months to get licensed or a year to get credentialed by an insurance company. Those coverage and payment policies that encourage coordinated care. Let's invest in critical healthcare infrastructure. Long-term care, as an example, is sorely needed in Puerto Rico. And in the United States, Medicaid is the primary payer of long-term care. So if Medicaid covers the service, the supply will come. You got to have the funding so that the supply is realized. And again, we're going to make some challenging decisions about how we allocate the funds. And we got to make sure that every opportunity for healthcare funding that's available is pursued. There is unfortunately a history of Puerto Rico missing out on federal healthcare funding opportunities for a number of reasons. That cannot happen in the future. We got to avail ourselves of every dollar of federal funds is available. And with that, I turn it back to Arnaldo.
Oh, thanks a lot, Gobernadora. Mucho trabajo que tenemos por adelante. So anyway, thanks for the FTI team for the report. Obviously, this is the first step in addressing some of these gaps. It's been a challenge to address them because we didn't have the data. So this information allows us to be more strategic and more specific. Not all gaps are the same. Not all the gaps are the same within the island of Puerto Rico, so we need to be strategic with the limited resources that we have. And although the picture is grim, there are things we can do together with the government that are what many people call low-hanging fruit to start addressing some of these gaps. And we are, with the next step of this process is we are going to be meeting with the government, with the chief of staff, and with the Secretary of Health and the team to start working on how we go about implementing, how we go about sequencing some of these recommendations, and we can start closing these gaps so we can have a stronger healthcare system. So, Mr. Chairman, Mr. Executive Director, we finish here with the report of FTI.
Thank you, Arnaldo and FTI, for your presentation. Would Robert or any board members like to comment on the presentation?
I just want to make one comment. One, I want to thank Arnaldo and the team for the thorough report. You know, it's an honest assessment of what things are, but it also represents an opportunity for us to be able to deal with what we're seeing in this report. We asked that the reason for this report was to inform the government of what things look like. So when we make decisions on resource allocation, we can fund the initiatives that we think are going to make the biggest improvement or make change. We do have an opportunity to provide additional funds. We want the government to be able to, they've already established healthcare as a priority, and we just want to make sure that the allocation of resources that we have to put into the healthcare space goes into things that are actually going to result in some meaningful change. So we want to work with the government on identifying resources to fund initiatives, and this is a real opportunity kind of to take the step forward and do that in this year's budget, right, and the ones coming forward. So this is just the first step, and this report belongs to the government of Puerto Rico, and the team is available, right, to everyone, right, to follow up. So thank you.
Anyone else?
Yeah, I have a few comments. So first and foremost, thank you to the FDI team. As you well know, in our internal meetings, I was quite intense about all the information and gathering that data. What I do think, and actually this is a great opportunity for the government, the board to work together, and the private sector. Very similar as what I did when I was the president of Chamber of Commerce, when our now governor was resident commissioner. We worked together and we actually pushed forward and kind of avoided and got higher capital for the Medicaid cliff. So I think taking this data, putting it together, working together with the government and the private sector to go and advocate for the issues that we will be facing in 2027 about the Medicaid cliff is actually an opportunity that we definitely should act proactively for. So just wanted to, once again, thank FDI Consulting for being here, and thank you, Governor, for being here. And that's pretty much regards to my comments. So thank you.
Governor?
Thank you, Mr. Chairman. Yes, I want to comment on so many areas. Not trying to extend more than the study. Obviously, we share many goals that are implemented in this study. The reality is Puerto Rico depends on Medicaid funding. And on federal funding for most of our programs regarding healthcare. And that reality brought me, when I was a member of Congress, actually I came to this board to explain all the areas and bills that we were requesting having support because we're losing a lot of physicians to Florida. They move there. They don't have many of the credentials they need to file on the island. But of course, the wages are going to be completely different because the way Medicaid program pays them on the island is completely different to the way they're being paid in other areas. For example, you were talking about long-term care, which is one of the mandatory programs of Medicaid. It is not accessible on the island. So we can be talking about the 21 programs that may be mandatory on the island. We just got 17, and the reason we keep adding some of them is because of the surplus of funding that we actually granted on the deal we did in Congress, that is going to be extended until 2027. So we need to begin that process with Congress already to negotiate and trying to extend the allocation of funds that we do have. And during the past, the board was instrumental on the first deal. I remember we got problems on the Senate side, establishing fraud units on the island regarding Medicaid. That was one of the main considerations at the Senate at the time. And those goals were fulfilled, and we received the rest of the funding. So those programs are still in place. Credentials, that's one of the things that is in our platform. So we're going to be working to that end. Permitting and the streamline of the process is necessary as well, and extending the amount of students of medicine that can be on the island. So we just opened a new program of surgery and neurosurgery on the island. So we can even provide to the board, because I don't want to extend myself on this issue, but I do know this is the most important and pressing issue on the island. We're losing people that are moving to the States, not because the beaches are better there, but because of healthcare, specifically aging people on the island. So yes, I agree in some of the areas, and we're going to be working on some of them at the state level. So thank you.
Thank you, Governor. All right. There being no further comments or questions, we now have concluded the substance of today's meeting. I understand we have time for a couple of comments from the public. So we can now turn to the public commentary.
Yes. Hi, Mr. Chairman. We have 2 petitions. You can come forward. Okay.
Good morning. My name is Javier Rua Jovet, Chief Policy Officer at CESA, the Solar and Energy Storage Association of Puerto Rico. Governor, thank you for your support of industry in the past as Resident Commissioner. You filed bills as Resident Commissioner to keep the lights on for Puerto Ricans with solar energy, and also as Resident Commissioner, you were a co-leader in requesting this board to stop their attacks on net metering. So thank you for that. To the fiscal board, chairman, executive director, members, we want to collaborate. Before that, I want to say Camera McKenzie, a great addition to the board, a Puerto Rican that has the public interest always in front. Short story that I want to say here, I was a stakeholder when Act 17, Puerto Rico's renewables law, was being drafted. Vice President of the Senate, Larry Selhammer, opened up the floor for stakeholders, and we were there. Net metering was not an issue in Law 17 because it was legislated since 2007 with no end. Puerto Rico was about to enact a 40% renewables law. We were supposed to be 40% by this year. But then the fiscal board sent an emissary, the prior executive director of the fiscal board sent an emissary to that Senate
to say, basically, we will not support this unless net metering is changed. And that became a lot of pressure into the senators, but then that became kind of a deal that was written into that law, that net metering was going to be taken, there was going to be a fresh look at net metering in 2024, back, in the far future, 2024, when Puerto Rico will be on path to 40% renewables. But we're not there. And we're not there in partly because even despite the fact that the fiscal board keeps talking about their defense of the regulator, the fiscal board undid over 450 megawatts of large-scale solar that were approved by the regulator. And that's part of the reason why we're not close to 40%, and that's part of the reason why none of the large-scale RFPs succeeded, because it created the worst market signal puzzle. And now, using that similar narrative, now they're saying they're defending the regulator by attacking Act 10 of 2024. My request to the fiscal board is, please withdraw this lawsuit. Please, it's a wasteful action, and withdraw with prejudice. And my request to the governor, and we've asked before, and she's always been a supporter, if the fiscal board doesn't do this, that case is submitted, there might be a negative decision by the court any moment. Our request is keep fighting, appeal that case, ask for a stay of that decision if it happens. But I think no one wants litigation. I think there's ways out of this, and we always want to collaborate, but we have not been given, at least by the fiscal board, the chance to talk about this in a rational way. So that's our request. We like to collaborate. We don't like to fight, but we need to keep the lights on in Puerto Rico. Net metering, the 1 gigawatt of solar already in people's roofs is helping stop 25% of blackouts for everyone. And we're focusing in attacking this, the only policy that has been successful in Puerto Rico. So that's our request, and thanks for the opportunity.
Thank you.
Thank you.
We have another gentleman here. Please stay to the limit time. Thank you.
Buenos días.
Thank you.
Another one. Okay, go ahead.
Thank you for the opportunity. My name is Alex Ortiz. I'm a disabled combat veteran, both Iraq and Afghanistan. And Governor Gonzalez, I appreciate everything you've done for veterans over the years. I'm here because I want to make aware to the board. Since I have only 2 minutes, I had a little bit more, but there's 69,000 veterans here residing in Puerto Rico, which bring $2.2 billion in annual spending from the Department of Veteran Affairs. 34,866 veterans have a disability rating, and they bring $1.1 billion in net income that's spent throughout the whole island. We have 3,122 student veterans bringing $53 million to education around the island, higher education, University of Puerto Rico and University of Inter-American University get the most funding from this. We also have Vietnam veterans, which is our largest population, and their ages complicate the situation because they can't really advocate for themselves. I mean, we can't pretend for them to go, be forced to serve during the draft and then come back home and not be taken care of. So the Office of the Ombudsman has been underfunded, understaffed for many years, and it's something that the governor has addressed to us, and she's making sure she has a plan established that I hope it comes to fruition, which is the reason why I'm here. Mainly, the ombudsman has the ability through the law, I think is Law 79 of 2013, to go and fight for us either in a state or federal forum. We have no representation in Congress in terms of going directly to the House or Senate Veterans Committee Affairs, and this is a job that the Office of the Ombudsman could be doing, right? They know they have the data, they have the capacity and law to do it. So I ask that you work with the local government to establish these benefits for veterans so we can continue bringing more funding for them. Thank you.
Thank you for your service.
Thank you for your service, sir.
Yes, Robert, go ahead.
Just to respond to a couple of the comments. One, on the speaker who just came up now. We haven't seen this proposal yet, but we will work with the governor on this proposal. We're doing the budget right now if additional resources are necessary for that, right? This could be a priority for the board, and we'll talk to the board members. So we'll pursue that in the budget process. So we look forward to getting that proposal.
On behalf of all of us, thank you for your service, and thank you for bringing this to our attention again.
Yeah, and thank you for your service. On the issue of net metering, or really Act 10, the board's position, just to be clear on this, is not related to net metering. What Act 10 does is takes away the ability of the independent regulator, which becomes more important now than ever before. The independent regulator is relatively new to Puerto Rico, and it's maturing as an independent entity. It was established in Act 17, or before Act 17, reinforced in Act 17, for the purpose of making decisions outside of the political process. So we just want PREB to actually make a decision based on their own data with regard to this. Whatever they decide is what we should move forward on. One of the issues with moving forward on some of the renewable projects, right, this is a cost issue, right? Some of the projects in Puerto Rico happen to be among the most expensive projects in the country. Some, not net metering. 3,000 to 4,000 people are doing ones on homes right now, and we're very much in favor of those projects. And we have approved 1,000 megawatts. Have been approved so far. Many of those projects aren't, besides the rooftop solar, which are the most successful, and those are actually going and continue to go, and we encourage them. Besides those, many of the other projects are really slow to get done, whether it's permitting, right, whether it's the bureaucracy between the individual energy companies. Those need to get done because they have been approved. And many of them are going to take 2 years, if not longer. Some of them have been in development for 3 years. So there's two parts of the process. One is approving these projects at an affordable cost, and also making sure that the ones that are approved actually get lit and actually begin producing power, because they're not. And we hope that the 3,000 to 4,000 projects for the rooftop solars continue, but we just want to get the information from PREB and make sure that they have an opportunity to opine publicly like the original law envisioned.
Thank you, Robert.
Thank you. Chairman, we receive several questions related to collective bargaining agreements that the Oversight Board is currently reviewing right now, and we will answer each question in detail in our website.
Thank you very much. There being no further comments or questions, we now have concluded the substance of today's meeting. I understand it'll be time for a press meeting after we conclude. I'd like especially to thank Robert, our staff, Governor Gonzalez and her administration, and all of you for joining us today. As I mentioned earlier, we'll be handling any additional comments and questions through the Oversight Board's website. Does any board member have any other matter to discuss today? Since we have no other matters to cover, do I have a motion to adjourn this meeting?
Mr. Chairman, I move to adjourn the meeting.
Thank you, Andrew. Do I have a second?
I'll second.
Thank you, John. All those in favor say yes.
Yes.
See.
Opposed? Abstentions?
I got credit.
Our meeting is then adjourned. Thank you.
Allow me to take a picture of you guys.